Hello everyone. Today in this video I will be talking about the corneal opacity. The corneal opacity is a disease of the eye in which there is the scarring of the cornea, and because of this scarring there is significantly reduced vision in the affected individuals. Now what the cornea is? The cornea is located in the front part of the eye, and it is a transparent structure. Cornea, it helps in bending the rays of the light so that they are focused on the retina, and it also protects the eyes from the harmful ultraviolet rays and from the harmful chemicals which are present in the air, like the dust particles or any foreign body or any pollen grain, all these things. So what happens in the corneal opacity? Now, when the corneal opacity develops, the cornea loses its transparency, and now because it's had lost its transparency, the light which normally passes through the cornea is unable to do so, and it results in the formation of decreased vision and also in the formation of the distorted images, which are very symptomatic for the patient, and the patient loses his or her vision. Now, the second thing is that how the cornea is affected by these corneal opacities. Now, the corneal opacity may be present in the central part of the cornea or in the peripheral part of the cornea, or it can affect the whole cornea and it can make it opaque. Now, these corneal opacities, they can be present from birth. So, if they are present from birth, they are called as congenital, or they can be acquired in the later stage in which they are called as the acquired corneal opacities. Now, whenever these corneal opacities are present since birth, they are generally also associated with other malformations or other developmental abnormalities of the anterior segment of the eye, and is generally present since birth. Now, if a child presents with a corneal opacity, he or she can also have like flickering movement or the wandering movement of the eyes. His eyes will keep on moving, which is called as nystagmus. Or he or she can also have any abnormalities of the lens, like he can also have congenital cataract and a lot of other things. Now coming on to the acquired corneal opacities. The acquired corneal opacities, they generally develop in the later stages of life. It is commonly associated with either an infection which is called as keratitis or any injury of the eye. Now this injury could be because of many things, like any foreign body, any organic matter, like the leaf of a tree, or any trauma which has occurred, like if the patient is grinder by occupation, he grinds the wood or the stone, so these flying objects can affect the eye, it can injure the eye, and it results in the corneal opacity. Now let's discuss that who all individuals or are more uh, prone for developing corneal opacity, or the risk factors for developing corneal opacity. Patient who is having any history of ocular trauma, the patient who uses contact lens very frequently and for long duration of time. There are few people who sleeps with their contact lenses. So whenever you sleep with your contact lenses, or whenever you use the contact lenses for a long period of time, our cornea is unable to get enough oxygen. In simple words, if I say, the cornea is unable to breathe. Now, since the cornea cannot breathe, it damages the cornea, it results in infection and the development of corneal opacity. Patients who are having history of measles, any history of viral infection like herpes simplex virus, or who are having deficiency of vitamin A, all these factors also predisposes the individual for the development of corneal opacity. Now coming on to the symptoms of corneal opacity. See, if any individual is having a corneal opacity, the light which is falling on the eye is unable to reach the retina. So the patient will have blurring of vision. If there is associated infection, there is a foreign body sensation, pain, redness, watering, lacrimation. All these things are the symptoms of corneal opacity. Now coming on, what is the treatment of it? So the treatment of corneal opacity depends on the grade of corneal opacity, means how much part or the how much thickness of the cornea is affected. See, if only the superficial part of the cornea is infected, we can do a PRK procedure, that is the photorefractive keratectomy. In this, we abrade or we remove the superficial part of the cornea, the new epithelium is regenerated and we get a good cornea. Now if but this process is this procedure is successful only for the superficial corneal opacities. Now if the corneal opacities are deep or if it is involving the whole of the cornea, we will have to completely transplant the cornea. So the corneal transplantation is that we retrieve the cornea or we take the cornea from a dead individual, we store it in a media for few days or like for few hours, and then we transplant it or we suture the cornea from to the individual who is suffering from the corneal opacity. So as you all might be knowing that the corneal transplantation is a type of transplantation which has got the highest success rate in among all the other organ transplantation. So I hope you found this video useful. See you in the next video. Till then, goodbye.